Tackling obesity, a wicked problem. Obesity is a condition caused by genetic, psychological, biochemical, environmental, social, and economic factors that results in excess body fat accumulation. This excess body fat adversely affects overall health as it is associated with diabetes, osteoarthritis, cancer, and major cardiovascular diseases including hypertension, stroke, congestive heart failure, and coronary artery disease. In Canada, 54% of adults and 23.1% of youth are considered overweight or obese. By 2040, experts estimate 70% of 40-year-olds will fall in this category. This costs our healthcare system $4.6 billion annually. Since obesity is a lifelong condition, interventions should be addressed as early in life as possible, as it is difficult to reverse once a child becomes obese. Furthermore, overweight children only continue to gain more weight as they age, leading to obesity in adulthood. So why is obesity on the rise? Many factors have been implicated. More and more families are lone parent or have two working parents, giving them less time to prepare nutritious meals. Due to working families, children are more often attending daycare, a known factor that contributes to childhood obesity. This is because there is no specific government policy regulating the provision of nutritious meals in these centers. There is also the issue of low socioeconomic status that prevents families from being able to afford high-quality nutritious foods, opting instead for high-calorie, inexpensive items. It has been proven that eating these high-calorie, inexpensive items as a child conditions an individual to crave high-sugar and fatty foods, resulting in a lifetime of unhealthy eating. We also have the issue of children being too young to make informed choices, especially when inundated by advertising for fast and junk foods. Finally, the government lacks provisions related to the marketing of food to children. So what can we do to change this trend? There are so many options that can be instituted to address what has been discussed, but we feel the most important thing that can be done right now is instituting a federal mandate to ban the advertising and marketing of unhealthy foods and beverages to children less than 13 years of age, by amending the Broadcast Code for Advertising to Children to include a clause regarding food product advertising. And why is this effective? Well, it has been proven to work. Of all product categories, fast food is one of the most heavily advertised products targeting children. Even the United Nations and World Health Organization advise for greater restrictions on the marketing of these items to children. Yet in Canada, the current policy merely encourages food companies to self-regulate advertising through the Broadcast Code of Advertising for Children with no government oversight. A 2011 Canadian study showed that an advertising ban lowered fast food consumption by 13%, while a 2015 study in the United Kingdom showed decreased household expenditures on unhealthy foods when children's food advertising was banned. Limits and bans on advertising unhealthy foods could potentially save the healthcare system millions of dollars in expenses related to battling diseases associated with obesity. So how do we know this? In Canada, smoking has dramatically decreased as a result of the total advertising ban of tobacco products. So what if we ban the advertising of unhealthy foods to children in order to tackle the issue of obesity? So how can this be done? All food and beverage advertisements in Canada, regardless of the media outlet or viewing time, would be regulated based on content and appeal to children through government monitoring. This policy should include a minimum set of standards and potential penalties to ensure compliance. And the cost to taxpayers? $0. And the reward? Decreased obesity in children, leading to decreased obesity in adults, resulting in saving our healthcare industry millions of dollars. The final outcome? A healthier Canada.